And welcome to Deuk Spine Institute's live stream. It is March 28, 2024. I'm Dr. Deuk Majan here with my team. Our patient has back pain, chronic back pain coming from the L3-4-4-5-5-1 disc and right-sided facet joints. We're going to start by performing the Deuk laser disc repair to repair the discs that are causing pain, specifically 3-4-4-5-5-1. Now, on the x-ray, you can see the 3-4 disc is degenerated, meaning it's collapsed. There's modic changes. There's sclerosis of the end plates. There's bone spurs. There's loss of height. And the disc material itself is drying up and herniating. Shot? Okay, let's start with L3-S1, Jordan. Let's bring the fluoro slightly south. That light is right in my eye, Dr. Berndes. All right, that looks better. Okay, 3-4 is degenerated, 4-5-5-1. Now, the discs at 4-5 and 5-1 are herniated. And Henry, let's show the audience how is it that a herniated disc can cause so much pain. Shot? Meanwhile, I'm going to keep working on getting the needle into the actual herniation.
Your legs.
All right, welcome back. You can see from our video how a disc injury is going to cause so much pain. It's really due to inflammation that is at the tear. We call it the annular tear. AP? So discs have two parts. They have a wall made up of collagen and elastin that's mostly collagen, and then they have a jelly center called the nucleus pulposus. The nucleus is made up of proteoglycans and glycosaminoglycans, primarily, which are really hydrophilic molecules. They like water. Anyway, the nucleus material is really kind of a shock absorber, but to be honest with you, it's more or less a remnant from embryological development, where you are developing in utero, and as a fetus, that is, and basically you have this notochord structure which you need to get rid of. As an adult, you don't want it lingering around. You doing all right? You're doing great here. Surgery is going very well. And so, long story short, I'm actually going to make my incision this way, just to be a little different. So that notochord needs to go away after it does its job. And what happens with the notochord is it becomes the nucleus pulposus. Lay still. You're doing great. We're going to be done soon. Okay? Now she is from Kansas. Is that the latest shot right there? She's from Kansas, and they traveled here to have this procedure done because she's been suffering with back pain for a long time. And she didn't like the fusion option, so she chose the Deuk laser disc repair. You okay? Yeah, I know. That's where we're working. We're almost done. We're going to put you to sleep in just a minute. Bear with me, okay? You're doing awesome. Everything is going as good as it possibly could go for you. I'm having a conversation with her. So people want to know, why is the patient awake? Well, believe it or not, we do awake surgery because we need the patient's involvement in the surgery. We need their help. And she's helping me to make sure we do this surgery as safely as humanly possible. Shot? So I'm going to put her to sleep in just a minute, but I need her help for the very beginning. Yeah, we're right where your facets are. Where do you feel that? Yeah, that's exactly where I expect you to feel it. All right, we're done torturing you almost, I promise. You okay? All right, we can't have a lengthy conversation. Just keep the answers or questions simple. What did she ask? Berndes, can you understand her?
What did you say?
Oh, the mask. Aha. We'll take care of that. That's not my department. That's Dr. Berndes' department. All right. Sorry about that. The mask is there to provide you with some extra oxygen. So when I asked her, where is your back pain, she showed me this whole area right here.
That?
Good. Good. I'm sorry about that.
We'll get that fixed for
And when I looked at her MRI, I saw that we had two discs, the L4-5, L5-S1, that were clearly torn, inflammation in the annulus, and that the L3-4 was collapsed, like you're seeing it right now. Show us the collapsed disc at L3-4, Jordan. You guys see that disc? It's degenerated. So what that means is she injured that disc a long time ago, like probably 30 years ago. And it's been causing pain for her for 30 years. How long ago did you get your back pain for the first time? Years. How many years? Like 30 years? In 90?
1990.
Yeah, so that was, what, 34 years ago? Yeah, 34 years ago. I was right. 34 years. She had a car accident. Okay, she's had this problem for 34 years. Are you comfortable now? Have you watched these surgeries? Yeah. Do you remember what's next? Yeah. What?
You're doing great.
What's next? No, not quite. You forgot part. How bad is that on a scale of 1 to 10?
9.
Is that where you get your back pain? Yeah. Hey, that's great news. We're going to fix that for you. Is it better now? Yeah. All right, just take a deep breath. Sorry about that.
Great.
I promise. We just want to make sure we're fixing the right thing. How bad is that on a scale of 1 to 10? 10? Is that where you get your back pain? Sorry about that. I promise we're almost done. How bad is that on a scale of 1 to 10? 12? All right, is that where you get your back pain? You get to go to sleep. When you wake up, that pain will be gone for the rest of your life, thanks to Deuk Spine. All right, so what do we know? We tested 3 of the discs that I thought were causing her pain, and whammo, all 3 were causing her pain. L5-S1, 9 out of 10. L4-5, 10 out of 10. L3-4, 12 out of 10. So what surprised me, I thought L3-4 was going to be painful, but I didn't think it was going to be a 12 out of 10. So that was the most painful disc she has. Good news, we're going to fix all 3 with the laser, the Deuk laser disc repair, available here at Deuk Spine Institute. After we're done, we're going to fix her facet joints because she's got facet pain. So she's got 3 bad discs and 3 bad facets. We'll do that as a separate broadcast. Any questions?
At this moment, no current question.
All right, well, without further ado, shot? Shot? Our guide wire is in. The needle comes out. We're going to lose almost no blood. This is pretty much a bloodless surgery. There's no hospitalization. She goes home an hour later. And guess what? We're not damaging the inside of her body with the surgery. We're not cutting her. We're not slicing her muscles, cutting her fascia. We're not removing bone or laminectomy or facetectomy. We're literally going through a hole that's already there. And we're not doing any damage to her. She okay? So I'm going to give her a little numbing medicine. But she won't need any narcotic painkillers after the surgery. So if you're somebody who's afraid of having back surgery because it hurts so bad, this surgery doesn't. People heal up without pain medication. They take a Tylenol. That's it. You okay? She's sleeping. Good. Because this part is a little bit uncomfortable. This is where we put our dilator and tube through the herniation. We push it back into the disc. Any questions?
At this moment, no current questions.
All right, let's show the audience our video on how this surgery actually works.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Making them on it is 1, 2.
Welcome back. And you can see from our video how this surgery works. We put a tube into the disc right through the herniation and tear. And that's what we're looking at right there. You see the pink stuff? That's the inflammation tissue, inflammatory tissue. And there's our first piece of herniation coming out. Now the herniation is never one herniation. It's always many pieces of herniation. So I would say the average I see is around 35 to 40 pieces of herniated disc per disc that I'm fixing. So in her case, since we're fixing 3 of her discs, we would expect to see somewhere around 100 plus pieces of herniation. We just saw about 10 of them go by. Again, we're working through a 7mm tube, folks. The entire surgery is done through a 1/4-inch incision. Did you guys see that on the skin? A 1/4-inch incision, we're fixing 3 discs. Any other surgeon would have to do a fusion, and they would actually make an incision that's 12 inches long to do that. Now that's why people have so much pain after open back surgery, is the incision, the muscle dissection, the fascia dissection, the removal of the bone and ligaments that destabilize the spine that require fusion. Major surgery is the alternative to this treatment. And we're able to fix this woman, her back pain, more reproducibly, more consistently than invasive spine surgery. There's lots of horror stories with invasive spine surgery, how it doesn't work. We don't have those stories because I've never seen a patient, I've never had a single patient that this surgery did not work for. Now, we've had patients that develop back pain from other areas after they have the surgery. Not because of the surgery, but kind of like if you have a broken arm from an accident, you get your broken arm fixed and then you go have another accident and you break your leg. Well, the broken leg has nothing to do with the broken arm or its repair. It's another accident and it's another problem, okay? So a lot of people have more than one cause to their back pain. As a matter of fact, only 10% of patients have back pain from one cause, one disc, or one facet, or one SI joint, one piriformis. 90% of patients have multiple causes to their back pain. That's a big piece of herniation right there. Just laying there, waiting for me to come and get it.
We have a question.
Sure.
This comes from Georgios on Facebook.
Georgios. Georgios, do you work? Just kidding, Georgios.
Their question is, Dr. Deuk, when you are doing a DLDR on the L4 to L5 disc, which nerve are you helping alleviate impingement from the L4 or the L5 nerve?
Both. You can help impingement of both the L4 and the L5. Because the L4 is the exiting nerve root, which is above the herniation, and the L5 is the traversing root, which is medial to the herniation. So you're actually helping both. It just depends on where the herniation is located. If it's in the foramen, then you're primarily helping L4. If the herniation is in the lateral recess, paracentral, then you're primarily helping L5. But it's both nerves. That's a very good question, Georgios. I'm glad you asked it.
And it's a rebuttal. They answered that they are retired.
Ah, wow. Well, I hope you're retired for good reasons, not bad reasons. Not because of pain. I thought about retiring, but truth is, I enjoy what I do too much. Oh, we're not connected here. Maybe it's this.
Good.
I think it's okay now. There we go. Look at that inflammation, guys. Oh my gosh, it's perfect. Textbook perfect. If I can just get the picture a little better. All right, you guys see the inflammatory tissue, Henry?
Yes, we do.
That's beautiful. That's exactly where pain comes from. Georgios, check this out. We're getting rid of the source of pain right there. That is what causes the back pain. I've been saying this for years. And you don't need to do a fusion on the disc. You don't need to take all the bones out, ligaments, muscles. You don't need to do open back surgery anymore. Microdiscectomy, unnecessary. You don't get to see that tissue there with a microdiscectomy. You only see it endoscopically. And microdiscectomies cannot see that. How do I know? I used to do them. I was trained on microdiscectomies. I actually have done many of them, and I do them very well, but I don't do them anymore because it's unnecessary and dangerous for patients. Laminectomy, unnecessary. All you need is this procedure. It replaces fusion, laminectomy, artificial disc, microdiscectomy. Pretty much all those procedures are too invasive and unnecessary. This surgery replaces all of them, and it's far better for patients. The results are better, the recovery is faster. There's no need for post-operative narcotic or pain meds with this surgery, but you do have to when you do the open surgeries. Well, that's about it. We're pretty much, this is L3-S1, and this is the end of the herniation here. I'm going to look around a little bit just to make sure we get everything we need to. Have we played the educational video?
We played both, correct, yes.
This is a piece of herniation that's really scarred. You guys see that? This has been around. This is an old herniation. Old, old, old. Old and bad. It's putting pressure on the nerve. That's on the right side there. That's where the nerve root is. That would be the L5 nerve root. Grab her. So it's that really hard, scarred up herniation that's responsible for a lot of the leg symptoms that people get when they have a herniated disc. Weakness, numbness, tingling in the leg comes from the nerve being pinched. Any more questions?
We have, I believe this is a comment and or seeking advice from Sammy on YouTube,
Hello, Sammy.
saying that I am a nurse suffering from cervical spine disc prolapse for more than 20 years from C3 to C7. I am a nurse working in Abu Dhabi. Last Friday, my spine surgeon told me that my case is impossible for laser.
It's not impossible for laser. If you want to know the truth, nurse in Abu Dhabi, please, on our website, DeukSpine.com, we offer a free MRI review. You can do it from Abu Dhabi, from the comfort of your home. And you can get the answers. I will tell you if laser will work. The problem is the surgeons in Abu Dhabi don't know how to do laser endoscopic surgery. And the problem is they will not tell you the truth, that they don't know how to do it. Okay? They would rather lie and tell you it won't work for you. It's easy. And that way they save face. But Allah is listening to every lie. And Allah will punish them for their insolence. Just do the MRI review and get the answers. If you're not a candidate, I would be the one to tell you, because I'm the one who does the surgery. You understand? Don't believe somebody who doesn't do that surgery. Believe me, I will tell you if you're not a candidate. And then you can have peace of mind. Thank you for sharing your story and having courage to do so. All right, we are now at the end of the disc. You can see here, this is the back of the L3-S1 disc. Lots of calcium from chronic inflammation. The laser has done a beautiful job. Here's a piece of herniation right here. I just have to remove it. Some of the herniation is too big to remove because remember the tube on the outside is 7 millimeter, but the inside is 5.5 millimeter. So some of the herniations are 3 times, 4 times that size. So we have to be careful about how we handle it. You sometimes have to break the herniation up into smaller pieces to get it out the tube. We call this bivalving, which means to cut it in half, okay, like a bivalve. You guys know what a bivalve is? A mollusk, you know? A mollusk?
A muscle.
A mussel, a clam. I think abalone is also a bivalve, right? Abalone. All those shellfish, they have 2 bivalves, but not a conch. That's right. A conch is not a bivalve, but abalone, mussel, scallop, those are all bivalves. And bivalving means you just cut it in half, basically, in surgery to be able to get the pieces out because they're too big to take out otherwise. Okay, almost done. Our patient again travels here from Kentucky. I don't think she's from Kansas. Sorry, I didn't mean Kentucky. I meant Kansas. You're correct. She's not from Kansas City. She's from Kansas. I think they're from West Kansas, if I remember correct. Yeah, they're all on one side of the state. I remember I was telling them I almost took a job in Olathe many years ago. And they lied to me on the contract. They told me I would be on call every 3 nights. And then when they gave me the contract, it said every night.
Are you serious?
Yeah. I said, I'm not taking call every night.
Every night.
It's crazy. Every night being on call. I said, I have no life. I live in the hospital. forget about marriage and children. You're basically a slave. So once they did that, I left. And I came to Florida. And aren't you guys lucky I did? Because if I had ended up in Kansas, I would not have learned the laser surgery. I would just be doing fusions like everybody else. But it's God's will that I ended up in Florida doing what I'm doing. Okay, done with one disc, L3-S1. I don't see any more herniation here. A little bit of fat, but that's okay. We don't mind. That's fat right there, by the way. You can actually see the individual fat cells. And I'm making a fat shake, a shake with fat. That's what that creamy discoloration is. I'm using the laser to remove, because there's still a little bit of herniation right there. I want to make sure we get it all. But everybody has fat around their nerve root. It serves as padding, protection, but it also serves as a storage form of energy. Nerves can use energy from fat. Okay? Fat is a very important energy source for us as humans and animals, all animals. There's only one tissue in the body that cannot use fat. Anybody know what it is? I know Dr. Berndes knows. The brain. The human brain cannot use fat for energy.
Gotta use sugar.
It has to use sugar, glucose. It's the only source of energy it can accept. By the way, there's a vein there. That's from Batson's plexus. That's the veins that are around the spine and inside the spine and around the nerves. Any questions, Henry?
No current questions. We do have a couple of comments. This first one coming from Sammy, once more on YouTube, saying, "I will send you my MRI. Thanks. God bless you."
God bless you, Sammy.
And then the next one from Georgios on Facebook saying, "Comment, Dr. Duke, we need to get you more advertised in Canada. There are a lot of people here that can benefit from your great work."
I agree with you. Thank you, my friend. But we're a small company and we don't have the money to do advertising like that yet.
Get patients from Canada, though, right?
We do get patients from Canada. Canada is our number one country outside the United States to get patients. Number one. But, you know, advertising is very expensive. It costs a lot of money. And I just can't ask people for more money. We already charge enough. And to add more cost to the patient is, for me, it's too difficult to justify. So I agree with you. I would love for the word to get out. I'm waiting for maybe Mark Zuckerberg. He's doing all this wrestling. Maybe he's going to need my surgery. And I'm going to tell him, listen, if you want this surgery, you first have to advertise my surgery and market it all over the world so everybody learns about it and they know they have another option available. Because right now, too many people are being told that they have to live in pain. There's no cure. Too many people are being told that the only treatment is fusion or laminectomy, invasive surgery. Too many people are turning towards alcohol and drugs or suicide to deal with their chronic pain. And it's a shame because we can fix all of them. And we want people to know this, but the hospitals don't want to market our surgery because it takes their business away. The companies that do all the marketing in spine, like Medtronic, Deuk, Boston Scientific, they don't want people knowing about this surgery. Because if we're curing pain, then their devices, their stimulators and implants are no longer necessary. So all that money they spent, billions and billions of dollars, to buy this technology that they can put this metal in people's body will go away. And it's a waste of money. Can I proceed?
Yeah, I'm gonna give a little more.
So I just read today in the news that Walmart started a medical service where people could go to Walmart to buy their groceries and stuff, but they could get a clinic. They'd go to the clinic and see a doctor, right? They called it Village MD, like village doctor. So you think of a village as where you go to get groceries, to get, see the medical man, the shaman, whatever. So you go to Walmart, you get everything you need. Pharmacy, prescription for eyeglasses, dentist, doctor, everything. They want to create a village. And they just decided to abandon that investment. $5.8 billion. $6 billion they just threw away. Now, when I throw money away, which I do, I make bad investments at times. I don't throw away billions because I don't have billions, but the point is, there's an old saying, you can't make money if you don't spend money. So you have to spend money to make money. Point is, Walmart made an investment in Village MD, $5.8 billion, and they have to scrap it now because it's not going to work. I admire them for admitting it, and I admire them for accepting defeat rather than going on and continuing to take a financial loss and being irresponsible, right? It's better to recognize when you've lost and go back and try again and fix it the next time, make it better. That said, I wish someone would make an investment here so that we can get the word out, so more people can be helped. But I appreciate the sentiment, Giorgio. Okay, we are starting on the second disc. We've already fixed the L3-S1. We're now working on L4-5. Careful, I don't want it to come out. Shot? All right, good. Shot. Remember, this disc and the one we just fixed had annular tears with herniation. My aim is terrible.
Your hand protect me.
Yeah, I have to. I can't hit you. My conscience won't allow it. I need to sleep well. Any more questions?
No current questions, but we do have a comment
This is
once
a good
more
idea.
from Georgios on Facebook, saying perhaps you can train some trustworthy, skillful doctors that can open more Deuk spine clinics under your supervision.
Yes, Giorgio, that's exactly what I need to do. I agree with you 100%. I'm going to do that. As a matter of fact, probably this year and next year. And I've already started training one. Dr. Patel, my partner. And he would be the first person I would trust to do this. And I will find more. Because the truth is, what health problem is bigger than back pain and neck pain? Tell me one. There is none. I mean, sure, cancer, right? You all think of cancer as being horrible. But the truth is, back and neck pain is more common than cancer by far. The most common medical problem that people go to the doctor complaining is back pain. Okay? So it's a true, huge public health crisis issue. So I think it's a need for it. And the problem is I'm not very trusting of people. I am the type of person who it takes a lot to earn my trust, and I only surround myself by the best in the business because we're taking care of human beings. And somebody makes a mistake, the patient is the one who has to pay the price. Okay? And I don't want to be responsible for creating harm to another human that I could have prevented if I had done a better job of being selective about who I work with, who I choose to be with me in the operating room. So I'm very particular about quality Quality is the most important thing to me. Results, which are, quality is part of results, right? I mean, if you have low quality, then you have bad results. You're going to have complications. If you use low quality antibiotic, you're going to get infection. So the results are going to be infection. If you use low quality X-ray machine, then you're going to put the needle somewhere it's not supposed to be, and you won't be able to tell because you can't see it on the X-ray machine. If you use low quality sterilizers, then you're going to have infections. Okay, so all of these decisions that we have to make at Deuk Spine always have an effect on patient outcome. And I have never been willing to compromise my results for anything that has to do with money or any other factor. So for me, I've always bought the very best X-ray machine. I've always bought the very best autoclave. I've always had the very best people working for me. The best anesthesia and anesthesia equipment. So for me, I'm all about quality. But the problem is, you can't find quality everywhere. You have to search for it. And sometimes it will elude you so that it's very difficult to find. And that's really one of the biggest restrictions on growth of Deuk Spine is I'm not willing to compromise and hire people that won't do the best job for my patients. And I'm not willing to buy equipment that's cheap because it could affect the results of the patient. And in the end, the patient has to live with that complication. Not me. I get to go home every day and have a nice dinner and spend time with my wife or kids, and I don't have to deal with a complication. So I care. I care that my patients do very well and that they don't have complications and that they have the relief of pain that we want them to have and expect them to have. But that takes a lot of effort, which I'm only one person. I have great help, but expanding and scaling up has always been, something that I want to do, but I'm not just going to do it for the sake of doing it. I want to do it right. Thanks. All right, there's some more of that inflammatory tissue. You see the color is pink? That's because it's got inflammation. Good questions so far. Let's get that piece of herniation out of there. I wanted to build a facility in Orlando, Florida, but the costs are just too high. Unfortunately, in the United States right now, construction costs have gone 4 times higher than they were 10 years ago. And so building a new facility right now is out of the question. So it's hard to expand without money. If you have money, you can do anything. If I had money, I would build a new center in all the major cities and make this procedure available to everybody, and I would train doctors to do it properly. And I would be very selective. I would fire them if they didn't do a good job. I have no problem firing people who don't do a good job. Oh. All right.
Yes.
So far, this is going well.
5 minutes on this one?
I don't know. There's a lot of scar tissue. I feel like this disc has more to give. Everything is little pieces, little pieces, little pieces. It's very scarred in. It's not coming out easy. All right, what other questions do we have?
So far at this moment, there are no current questions.
All right. Yeah, there's more of the granulation tissue. You guys see that pink stuff?
Yes,
That's
we do.
the source of the back pain. Let's show that video one more time. The what causes back pain? The inflammation. So in the video you can see the area of inflammation. That's where all the pain comes from, and that's within the annular tear. The annular tear by itself does not cause inflammation. It causes very little inflammation, like minimal to none, just to heal. Well, the reason why people get so much pain is that the herniation gets into the tear and prevents the body from healing it. Much like a thorn in your skin gets in and you can't heal it while the thorn is still there, that piece of wood, right? So your body is trying to heal, and you get this inflammatory response, and you get pain and swelling and redness and tenderness, right? And warmth. That's inflammation. So that's what's happening here in the disc. The body is trying to heal it, but it can't. So we come in, and this is like removing the splinter. We were just talking about the next patient. Our next patient is going to be having a first procedure of its kind. She has horrible ankle pain and foot pain, and she is scheduled right now to have a fusion of her whole foot. They're going to put in metal plates and fuse her entire foot. And I said to her, let us try the Deuk plasma rhizotomy first. You know, if it doesn't work, then you go have your fusion. So we're going to be doing that. Unfortunately, it's going in room 2, so we're not going to be able to watch it here. We're going to be alternating into another room. All right.
Just give her a lot of num-num then. I'll put her to sleep deep. So she doesn't
Yeah, just sedate her with some propofol. She'll be fine. And you can give her some Versed too, right?
Sure.
Yeah.
Maybe a little ketamine on her so she doesn't.
Sure. Yeah.
I'm bringing my whole bag of tricks.
All right.
No current questions, but we do have a comment from Tom on Facebook
Uh-huh.
saying that they are looking forward to their surgery very, very soon.
Oh.
And after 10 surgeries, not one doctor told me what was wrong like you did, sir. Thank you.
You are welcome, sir. And I love fixing people's pain. I just wish there were more doctors that could do it. Yes, we're looking forward to helping you. You're doing great. Everything's fine. All right, we are almost done. We've got one more disc to do. Then we're going to move on to her facet joints. I have to say this has been not an easy one. It was relatively easy to get into the disc, but look at all this thick scar tissue. This laser can melt steel, but look at this. It's having a go. It's not a hard time, but what it is it's taking multiple strikes because it's so socked in. So I'm having to zap it like, instead of 2 or 3 times, at least 15, 20 times to get a release of the herniation. And I got to hit it on every point because it's like welded in here. So that is the herniation you're seeing. It's a piece of the herniation. It's welded into the tear. See that? It's just stuck there. So I've kind of released it, and now I'm going to try to pull it out. See if I can do that. Oh yeah. You got it? There it is. That's a good 2 centimeter piece. So you can see it's gone. We're getting this thing cleaned up a little bit at a time. Oh yeah, here's another piece. And just about done here. If you do this type of surgery, then make sure you go laterally, not just medial, not just to this 12 o'clock position, but get lateral. Make sure you look laterally, because a lot of times herniations can be lateral. I just saw a patient on the telemed who has a really big lateral herniation, and it's not even in the foramen, it's what's called extraforaminal, because it's so far to the side. The traditional surgery, microdiscectomy, would never, ever be able to reach it. It's impossible, 100% impossible. It's that far over. As a matter of fact, I have the most lateral approach, and I'm going to have a hard time getting to it with this. So, all right, we're done with this disc. The last bit right here. Now we're going to move on to L3-4. I don't expect the L3-4 to be as long as these, because the L3-4 is degenerated. It's pretty much gone. Let's see if there's anything left here. I feel like there's still a piece here. Oh, yep, there goes.
We have a couple more questions.
Sure.
This first question comes from, I love the name, Quit Girl on Facebook.
Nice. Welcome.
They said, you said before you're using more energy during the plasma rhizotomy compared to the standard RFA. What are common, if any, side effects or risks? This evolution in treatment sounds so logical that I can't understand why no one else is adapting to it.
Yeah, I agree with you 100%. The only thing I can tell you is, first of all, there's no additional risk. It's actually safer than standard RFA. But the tool I use is a surgeon's tool. And oh, here it is. The one that has been hiding. Oh, mama. The whole back is coming. Did I get it? Oh yeah. Well, that's big for the pieces we took out, but it's not as big as I thought it would be. So getting back to answering your question, the amount of energy I'm using is roughly 10 times what a normal RFA would use. And the tool I'm using, oh yeah, there's a few more pieces here, is a surgeon's tool. So here's the problem. Who does RFAs? Pain management doctors. They're not real surgeons. So they're not used to using surgical tools. So when I saw the problem with RFA, I thought, I could solve this problem, because the RFA doesn't work because they're not delivering enough energy, but they're also not moving the needle around. And if you move a needle a certain way, you can cut the nerve permanently, so the pain nerve permanently, so the pain never comes back. And of course we started doing it and we got the results that we have, which is complete permanent pain elimination. So you're right, somebody else should have thought about it, not me, but I guess I was the first, and we've patented it. I now own the patent on it. So it is a phenomenal technology that I'm going to be sharing with the rest of the world soon. Scope off.
Sitting out, please. I mean, not sitting, two off, please. Thank you.
So that's going to revolutionize the way pain management is done. RFAs are going to go away, and Deuk plasma rhizotomy will take its place. Now, when I share the technology in the future, the company that I choose to go with is going to help me with the manufacture and distribution of the device. So they may not want to call it the Deuk plasma rhizotomy, and you may hear of it from a different name. But that said, let it go. That said, it will be available eventually. Come on, Jordan. You can't just stop and wait. Just come in.
The last case, Ryan is here. Case Ryan is here. You want to wait with his Ryan, or
No, the last case can go. I already saw him. Yeah. Yeah.
he's getting a ride?
Mm-hmm. Let him go.
Thank you.
We don't really even need this section.
Son, there's something on the floor that I'm gonna need. Thank you.
Okay. So, yeah, I agree. Somebody else should have thought about it. But here's the thing. When you start to dig in, like why has nobody else thought about a permanent pain relief? Okay? The only reason I can think of, I mean, I don't think I'm that smart. I just think it was pretty obvious to me, but it should have been obvious to those other thousands of doctors that do those type of procedures. Now, it wasn't obvious to Dr. Patel, who does those procedures, RFAs. So if it wasn't obvious to him, maybe it wasn't obvious to them. But to the companies that make the probes, that make the needles, they're making billions of dollars a year on RFA. And if there's a curative procedure, right? What? Why are we behind on anesthesia? So the companies that, there's 1.2 million RFAs done a year in the United States. Worldwide, probably 10 million a year. So 10 million, and the average amount of profit or money they're going to make per procedure for those companies is probably somewhere around $50 US dollars. So, you know, that's on disposables, right, Luis? They got the probes, they got the actual generator, they got the needles. You know, I would say disposables $50, and then non-disposable maybe 100, so 150 altogether per procedure, times 1.2 million a year. Times 10 million a year. What is $150 times times 10 million? What is that? Henry?
Good question.
It's $150 times 10 million. Huh?
I don't know their zero.
Isn't that like a 1.5 billion or
It's
something?
just about to say 1.5 billion.
So they're making at least $1 billion a year on people not getting cured. Okay? Hold on. So they don't want you to be cured. Take it up. Do you understand? These companies do not want patients' back pain cured. So maybe that's why nobody thought about it. I don't know. You know, I just think maybe they didn't think about it. Okay? Maybe they aren't that evil. Because if I was them and I wanted to just keep people in pain so I could keep making money, I would have at least gotten the patent and then buried it, right? That's a smart thing to do. But they didn't get the patent. I did. So, like, I just have a feeling they were sleeping on their responsibility. So, whatever. It is what it is. I don't have an answer for you. All I know is that I truly believe God has given me the vision to see these things, and I don't know why, but I figured it out with the help of my friends. So, it is what it is. I guess I just paid attention and tried a little harder than the next guy.
You listen to that little voice.
Yeah.
Give you the idea.
You know, once we were able,
An idea, but it's something else to follow through.
yeah, lots of people have some ideas, but few people actually follow through. I guess I was at the right place at the right time to be able to do it. You know, I have my own surgery center. I own all the equipment here. So I was able to use my assets that I had and put them to work to create something new. Yeah. It's a great question. I've asked myself the same question over and over again. Like, why am I the one to figure out the laser surgery for the disc? Why am I the one to figure out the plasma surgery for the facets and the hips and the knees and the shoulders and the SI joint? I don't know. I don't have a good answer. I don't see myself as being that smart. I guess I don't take no for an answer. Right, Luis? I'm stubborn. So I refuse to believe that there's no solution. I know there's a solution. We just haven't found it. And now we found it. So that's all I can say. The rest is just history. It's interesting.
We have a couple questions.
Yeah.
This next one coming from Royal ViewTube on YouTube,
Oh, Royal of YouTube. We haven't heard from Royal in a while.
asking what is the cause and what type of back injury why a doctor would put a patient on amitriptyline.
On what? Amitriptyline?
Amitriptyline, yeah.
Yeah, amitriptyline is a drug that was very popular years and years ago.
Tricyclic antidepressant.
Yeah, and Dr. Berndes says it's a tricyclic antidepressant.
Supposedly supposed to blunt nerve action.
Yeah, the other name is called Elavil. And, you know, it used to be used in psychiatry as a mood stimulator to make people happier. But it wasn't a great one at mood stimulation, but there were better ones that came along.
Used for complex regional pain syndromes.
Yeah.
CPS and nerve injury.
But what they found was that the patients that were taking amitriptyline, aka Elavil, for their mood, suddenly their sciatic pain and nerve pain got better, right? It almost went away. And they thought, man, and maybe that drug is what's responsible for this belief that pain is mood related, you know? Depressed people have more pain. But they found that one of the side effects of Elavil was to stabilize, you know, nerve function, particularly painful nerve function. We'll be done in 5 minutes with this part. So they started using Elavil amitriptyline for treating neuropathic pain, you know, pain from nerves, with some good results. So that's one reason why doctors use Elavil, is to treat what they believe is nerve pain, but to also improve the patient's mood. I don't really use Elavil. I don't really prescribe meds anymore, but I do like Elavil. The only problem is it will make the patient sleepy a lot of time. Yeah. Yeah, blocks reuptake of serotonin, Dr. Berndes is adding. So, you know, you take it at night, and usually you take 25 milligrams, and if that's not enough, you can go up to 50 milligrams a night. But typically people take it at night because it does make them sleepy as a side effect. Now, if you have daytime drowsiness, then it's not a good drug to be on. Great question. Thanks for asking.
We have this next one is, I believe, a comment and or seeking advice from Rita on YouTube.
Hello, Rita?
Rita.
Rita.
Nice. And they said, I had 2 rear hits hurt from back, from neck down, now have arthritis, but immunocompromised always. So I'm just stuck now in hell. Would love at least to not have pain. Thought I had a hernia, my groin and hip hurt so bad. Told back hip arthritis is the pain, and I can't have steroid injections anymore, nor shingles from it.
Yeah.
Yeah.
Listen, we can help you, Rita. We can get rid of your pain. I just need you to do an MRI review. Go to our website, dukespine.com, and Henry will put the link. And fill out the free MRI review form. It doesn't cost you anything. And I'll tell you where your pain's coming from. Okay? If I can't tell you, then I'll order some tests and I'll send you the prescription for it and you can get it done. But I will be able to tell you where your pain's coming from. More importantly, we can fix your pain for you. All right, folks. We are done. That was L3-4. Scope use was an 8. Yeah. We're going to end the broadcast. We'll be back in 5 minutes with the next surgery, which will be the Deuk plasma rhizotomy for facet pain.
We do have one final question. This coming from Tracy on Facebook, asking, any idea if a knee DPR might be of any help if there is no significant arthritis but evidence of a torn meniscus, breaker cyst, and some tendinopathies?
Tendinopathy. Yeah, Dr. Davis is here. I'll have him answer that. He's our resident orthopedic surgeon. What do you think? Meniscus, Baker's cyst, and tendinopathy. Can the DPR help?
I think if the other treatments, such as a knee arthroscopy, clean out the damaged tissue, if they still have pain and problems, I think then a DPR would be helpful.
So one thing you can do for the knee question is this. This is what I would do. I would have your knee doctor do a shot in the knee with numbing medicine and steroid. If that shot helps you but just doesn't last, then I think the DPR would help you. I think our average pain relief for the DPR, 94%. That's our average at 6 months average follow-up. 94%. That's incredible without having to undergo major surgery, just with the DPR. So get your doctor to do a shot in the knee, and if that helps, then come and get your knee DPR done here with Dr. Davis. All right? And you can probably get somewhere between 80 to 90% of your pain gone. Okay, we're done with the Deuk laser disc repair, L3-44551, and our patient from Kansas who is here for back pain and from her 3 discs plus her facet joints. And I'll show you the incision. Pull back, Jordan, real quick. Let me show them our incision. You guys see this right here?
Yes, we do.
So I did a lot of drawing on her back. She'll have fun getting that off, but the incision was about 8 millimeters. So all of the 3 discs fixed through that incision. Next, we're going to do her facet. So we'll go ahead and end the broadcast and bring you back.
Copy that.